Welcome to the MI Mental podcast. My name is Dr. Sabine Fonderson, a general practitioner. This is the Doctors in Court edition and case number 6. The case of a cosmetic doctor that did not ask consent to laser twice. Plaintiff is a dark-skinned patient who consulted a cosmetic doctor due to a scar on her upper right eyebrow. The scar was a result of a wound she sustained, and it was a constant reminder of a traumatic event. During the first consultation with the cosmetic doctor, I will call Dr. C moving forward, she was told that the scar could be removed with a laser treatment. The procedure was successful, and she was advised to apply a calming cream after the treatment. The patient initially complained that the calming cream caused a rash that was itchy. Dr. C prescribed another cream called hydroquinone. The patient complied with this prescription. She later returned for a second laser treatment of the scar. During the second procedure, Dr. C lasered the scar and a pigmented lesion just above the scar. Later, the plaintiff returned with a hyperpigmented area above that scar. The plaintiff is filing a suit against Dr. C for causing extra pigmentation above the scar on her face. What do you think the judges ruled? Let us take a deep dive into this case and some important lessons learned. A female patient with skin type 5 attended a consultation with Dr. C, a cosmetic doctor. During that first consultation, which was an intake, the patient told Dr. C about a scar above her right eyebrow, which was a constant reminder of a traumatic event which occurred in June of that year. The patient wanted to get rid of that scar, and her goal was for the scar to be less visible to her and to others. Dr. C, the defendant, is a certified skin therapist of 7 years who consulted the female patient with the scar. Upon the consultation, she decided that the most appropriate treatment was to laser the scar with mixed 2 CO2. Dr. C provided the patient with information about the laser treatment, including what the procedure was and the side effects. The consultation ended with Dr. C informing patients to go through the information and to call the clinic in order to make an appointment once she had decided to start treatment. Let us stop here for a second. What exactly is mixed 2 CO2 laser treatment? According to the manufacturers of Slim Evolution, Mixed 2 Pro CO2 is a laser technology that is available for skin resurfacing, wrinkles, and scar reduction. It is an ablative laser treatment and therefore can and should only be carried out by certified skin therapists or a registered medical doctor. Furthermore, according to the Cosmetic Federation of the Dutch Society, mixed CO2 laser treatment is not indicated in people with dark skin colors because there is a chance of hyperpigmentation, meaning darker skin patches, or hypopigmentation, meaning whiter or lighter skin patches. This can occur after the treatment. In fact, the first contraindication for mixed 2 CO2 laser treatment highlights that this treatment should not be recommended to people with dark skin tones. Remember, the female patient had been assessed by Dr. C and had been assessed for having a type 5 skin tone. What is that exactly? According to the Fitzpatrick Skin Type Scale, there are 6 different categories, ranging from 1 to 6, from a lighter skin tone to a darker skin tone. So type 5 is considered a dark brown skin type that tans easily in the sunlight and rarely burns. Another recommendation is to use vitamin A acid only after the skin has completely healed and settled down after mixed 2 CO2 laser treatment. I will come back to this particular recommendation later in the story. Let us dive back to the facts. So after patient went through the information, she decided to start the mixed 2 CO2 laser treatment, and this occurred in November of 2018. Before the procedure, she signed a consent form for the treatment of her scar, which went through without any complications. 3 weeks later, at the end of November 2018, the female patient attended a follow-up consultation at Dr. C's clinic to assess the progress. During this consultation, the patient let Dr. C know that she was extremely unhappy with the cream that had been prescribed 3 weeks prior to apply on her skin in order to calm the skin after the first laser procedure on the scar. It is unclear what cream this was according to the court documents because there was no mention of the name of the cream in the patient file. Nonetheless, from the notes, we are able to deduce that whatever that cream was, it ended up giving the female patient an eczema-like skin reaction above her scar. So Dr. C decided to prescribe yet another cream, and she again failed to write the name of this second cream in the patient file. Dr. C also assessed the scar above the right eyebrow and determined that the first mixed CO2 laser treatment was actually good. The scar looked better. She also told the patient that in the event that the scar did not heal well, or there were some blemishes or imperfections after the procedure, the plaintiff could apply a hydroquinone cream which Dr. C would be able to prescribe. According to the patient file, the following was noted. Scar has nicely improved. I have told patient that several treatments are necessary. Patient is very unhappy with the cream. Has developed an eczema-like rash from this. Will get a new cream of no extra cost to her. First wait and see what eczema-like rash responds to. In the event of much discoloration or imperfections, then start hydroquinone cream. Need to be cautious with this and needs to protect from sun exposure. So plaintiff went home with this information, and in mid-December of 2018, she contacted the defendant, Dr. C, with a request to provide her with a prescription for hydroquinone cream. Dr. C prescribed this upon the request, however did not document this telephone conversation in the patient's notes. There is also no documentation of what type of cream had been prescribed. During the court case, the plaintiff was able to show proof of the prescription, and it is there that we find out that it was a combination cream of both hydroquinone and tretinoin. Tretinoin is a derivative of vitamin A. It is applied to the skin and causes inflammatory changes to the upper layer of the skin, causing the cells to shed through and prevents the formation of acne. So remember what I said earlier about one of the recommendations by the Cosmetic Federation regarding the use of this vitamin A derivative? Well, they recommend only using this cream after the skin is calm or has completely settled down or healed after a laser treatment. Dr. C told the judges that she contacted the plaintiff via email to inform her that she wanted to assess her skin again before she started her on the cream. However, the plaintiff said she would pick it up at the pharmacy anyway, but would not open nor use the cream until the next meeting or consultation with Dr. C. Now let us fast forward to April 2019. We're now 4 months later. The plaintiff, the female patient, returns to see Dr. C, the cosmetic doctor, with again 7 years experience for the second treatment of her scar with mixed 2 CO2 laser. Following the treatment, the doctor noted that the result was good, and during that particular treatment, neither the plaintiff nor the defendant discussed the use of the cream that had been prescribed 4 months prior that the plaintiff had gotten from the pharmacy and had promised not to use it or open it until the next appointment. In May 2019, the plaintiff decided to start using the combination cream of hydroquinone and vitamin A acid without consulting the doctor. In the second week of May 2019, the plaintiff wrote to Dr. C to say the following: "The cream you prescribed me, can I still use it whilst I'm exposed to the sun? I'm currently using it now in the evenings and during the day after applying a high-factor sun protection lotion." Dr. C responded with, "You can continue to use the cream in any event and in combination with a high-factor sunscreen. I will see you on June 3rd. At the end of May 2019, the plaintiff wrote to the defendant stating the following: "The vitamin A acid cream is really starting to irritate my skin and it's peeling and it burns. Are these side effects of the cream? I also notice on that area my skin is getting lighter. So should I stop using the cream or apply it every other day instead?" Then 2 days later, the plaintiff wrote back to Dr. C with, "Do you have any tips on what I should apply on my skin? It's peeling and it really hurts." A day later, Dr. C responded with, "Stop with the cream. Let your skin rest. Also, don't use any products with vitamin A or C." The second appointment was scheduled on June 3rd. However, plaintiff was late for that appointment and was asked to make a new one for the mixed to CO2 laser treatment. Despite being late, Dr. C made a quick assessment of the patient and wrote in the patient file, "Patient was late. I asked her to make a new appointment. She had some peeling of her skin after using vitamin A acid. Advised to stop using acidic products on skin. Scar looks otherwise calm." A day later, the plaintiff wrote to Dr. C and said, "Luckily you were able to see me anyway. Do you think that the darker spot will go away, or do I need a separate facial treatment?" To which Dr. C responded, "How did you get this dark spot?" Later that day, the plaintiff replied with, "I used the cream that you prescribed to me and applied it using a thin layer on a cotton wool for 4 days. It started to burn, and so I stopped using it. Then my skin started to peel. Did I not do it correctly?" 2 weeks later, both parties met for the third time in June 2019 to continue with this CO2 laser treatment. From the medical records, it seems that next to the scar, a darker spot had appeared just above the location that was lasered previously. And Dr. C documented the following: "Scar and dark spot also lasered. Advised as before, no more acidic products on skin." A month later, in July 2019, the plaintiff returned to Dr. C for a follow-up appointment. Here is what was recovered from the patient notes of that consultation. "Scar looks calm. There is hardly anything to see of the scar. Above it is a visible spot with hyperpigmentation. Patient has now started using hydroquinone. She also shaves it from time to time off with a shaver. Explained that doing so makes the spot even worse. Advised to stop the creams with acid and also not to use any hydroquinone or retinol. Protect well from the sun. In 2 months follow-up, then we will see if that dark spot has gone." After that meeting in July of 2019, neither the plaintiff nor the defendant spoke or saw each other again. The plaintiff holds the defendant, Dr. C, responsible for her pain and suffering. A letter dated in 2019 in December states that the plaintiff was not able to receive any financial reimbursement for this pain and suffering from the insurance company of the defendant. Okay, that is the whole story. Let us break it down to the main points. Point number 1. Plaintiff is suing Dr. C, the defendant, because she was not well informed about the risks of vitamin A acid creams and its application on dark skin tones as hers. Specifically, the patient was not aware of the risk of hyperpigmentation or further darkening of her skin tone. Number 2. plaintiff did not consent to the mixed 2 CO2 laser treatment of that darkened spot above the original scar that had been successfully lasered and treated. And number 3, plaintiff accuses Dr. C for giving her the wrong treatment of care for that dark spot because she decided to laser it during the second consultation. This wrong treatment ultimately led her to having a burn and a skin that was discolored and more pain. So what do the judges think? With regards to the first point, the judges find that Dr. C acted carelessly when she initially prescribed the hydroquinone and vitamin A acid combination cream in December of 2018 without having assessed the skin prior to prescribing. Dr. C did not provide enough information along with the side effects of the cream, plus she did not even document any of these things in the patient records. The judges acknowledge that this cream is a medication with side effects that include irritation and discoloration, in particular an increased pigmentation coloring in darker skin tones. Despite the fact that the plaintiff had said she would keep it at home without using it until they met again a few months later, the judges do not find this as an argument to justify the reason for not being more careful and provide adequate information about the medication prescribed. Knowing that the plaintiff had initially developed an eczema-like reaction after the first laser treatment, the judges find that Dr. C should have been more careful and prescribed a cream with either a lower concentration of hydroquinone or vitamin A acid, or in any event would have advised the plaintiff to apply the cream every other day and not on a daily basis. Because of the poor documentation, the judges could not find evidence that the latter was adequately communicated to the patient. With regards to point 2 and 3, the judges find that despite the fact that during the court case the defendant described the dark spot as post-inflammatory hyperpigmentation, this was not documented in the patient's notes during the consultation. Furthermore, Dr. C lasered that dark spot during the second laser treatment for the scar without explicit consent to laser the dark spot. The judges acknowledge that mixed 2 CO2 laser treatment has high risk of hyperpigmentation, especially in people with type 5 skin color. This means that any treatment, including laser, on a skin patch that was already dark or irritated with this CO2 laser treatment was not according to the guidelines nor recommendations, and it seems clear to the judges that the patch was initially caused by a reaction from the first laser treatment, and hence to re-laser that patch shortly after that and after the patient had applied a cream was highly contraindicated and not medically justified. And even in the event that Dr. C deemed the treatment to be necessary, she should have discussed this fully with the plaintiff and asked the patient to provide a new consent for the treatment of the dark spot above the scar. So, based on all these findings, the judges ruled for the defendant, Dr. C, to be reprimanded. They found Dr. C to have been careless in treatment of dark skin types with the mixed 2 CO2 laser procedure. The decision for this ruling was made anonymously and registered and can be found in the Medical Contact Dutch Journal. My take on this. Well, I found this to be a very interesting case and I learned a few lessons. And I also keep repeating in previous podcasts the importance of documentation. I get that from my colleagues and myself that we are busy and we have to do many things in a short space of time, and it's important to keep things short. And I've also received feedback in the past from colleagues about how much I write in my documentations. I don't think I'm going to change much of that, given how important it is to document things, because it helps the judges and it's really important in cases like this. I think that one of the most common reasons why doctors go to court and they get reprimanded is really due to poor documentation. And again, judges need to see the evidence of what has been said and what has been done. If you have any comments about documentation and how it can be improved in clinical care, I would love to hear or read your suggestions. I would also appreciate if you subscribe to the podcast to get alerted to the newest episodes. And very soon, I will host another Fast and Furious Doctors in Courts rulings, and these are typically a selection of 3 to 4 short cases that get you and me thinking on how we can improve clinical care and prevent going to court. Thanks again for listening, and until next time.